about simplicity with respect to the ease of with which it can be applied, but we are essentially talking about how relevant it becomes to our clinical practice, because most of the research that came up with was pertaining to low back pain, spinal disorders. And if you come to think of it, the major load when you talk about musculoskeletal practice comes from pain, and the most common area that is painful is the spine, and within the spine it is the low back pain, okay, which is the most prevalent kind of disorder. So when you're talking about job loss, or you're talking about absence from work, if you're talking about most common type of activities and disorders that activities and postures that cause pain, somehow or the other the spinal pain will come into picture, okay. And that is why when we talk about the McKenzie's concept, it has great contributed towards the understanding of spinal disorders, and it has not limited itself to only that, but a lot of research has gone into sort of formalizing the initial principles that McKenzie had put forth, okay. So it's not just his thinking, but all of it has been eventually scientifically proven. So his theories thereby got accepted, and not only locally, but they are also now worldwide accepted, okay. And all this has reached the McKenzie concept is also called as the mechanical diagnosis and therapy, which is a copyrighted terminology used by the McKenzie concept. So it is, the short form of it is the MDT, which is also an accepted acronym for the same, okay. So it all began as a chance finding. So while he was practicing, there was this patient who came to him after having had continuous pain for almost 3 weeks, and whatever they were doing did not really help the patient much in way of his pain relief, okay. So the patient was told to wait, and wait how? He was told to just lie in the prone position, okay. And this patient went and laid himself down in the prone position, but fortunately for him, on a couch which was slightly propped up for some other patient, okay. So you can see in the adjacent figure how it was, okay. And after